Honourable Member Drumheller-Stetler, followed by Manning. Drumheller-Stetler.
Thank you, Mr. Speaker. I've asked 6 questions, given 2 member statements, and presented a 1,000-person petition on the lack of acute care beds in the community of Consort. Still nothing. Once again, to the Minister of Health. It has been over 3 long years now that Consort has not had their acute care beds, and this government has had the time to find a solution. Consort does not want to hear the PC Pig Latin about mitigating circumstances. They want to know that these hospital beds will be returned to their community. Will they?
Honourable Minister of Health.
Well, Mr. Speaker, I've also had the pleasure of answering these same questions multiple times for the honourable member, and the answer actually hasn't changed from the last time that he asked. We continue to have challenges in the community of Consort, Mr. Speaker, with respect to ensuring sufficient volume to allow us to provide services that are safe and also to allow us to attract the required health professionals to offer those services. So, Mr. Speaker, the question is about meeting the needs of not just the citizens of Consort, but the surrounding area, and we are doing that, Mr. Speaker.
First supplemental.
Thank you, Mr. Speaker. As some members have said, this is question period, not answer period. Given that the Minister of Health continues to speak in bureaucratese about factors and circumstances, and he meets and consults without getting anything done in over 3 years, will he please tell AHS that enough is enough and that he expects acute care beds in Consort to be in operation as soon as possible?
Honourable Minister.
Well, Mr. Speaker, I think of all people, the honourable member would not want a situation where in the political sphere we were directing the delivery of programs and services at the local level. The question, Mr. Speaker, is a question for Alberta Health Services and their professionals to determine. The honourable member knows full well that there is a significant issue with respect to having sufficient volume in that hospital to allow it to deliver services safely and effectively and to attract the required health professionals. If and when we're in a situation, Mr. Speaker, where we have those conditions, I'm sure that AHS will restore the acute care service.
Final supplemental.
Well, thank you, Mr. Speaker. I guess I'm rolling towards 9 questions and no answers. Given that this is a secret of government that does not share information with the public and does not keep it as promises, will a Minister for Health once and for all break out of the PC government mold and show some leadership? Follow through with your promises and open the beds in Consort.
Well, Mr. Speaker, leadership would be recognizing the fact that with 99 hospitals across the province, we have to ensure that all of the hospitals are attracting sufficient volume of patients and health professionals to deliver services safely and effectively. A number of our smaller hospitals, including Consort, are facing these challenges, Mr. Speaker. That is not to say they do not deliver other community-based services that are very, very important to the community, like public health and mental health. Mr. Speaker, I appreciate that this honourable member would like the same hospital in his community that they had in 1970. The fact is, healthcare delivery has changed in Alberta.